When hair is dull, thin, or dry, there is a zinc, protein, or copper deficiency or protein-calorie malnutrition. When the face is pale, swollen, or there's dermatitis around the lips and nostrils, there's a riboflavin protein or niacin deficiency. When the eyes are pale, when there are fissures at the corner, gray spots, there's a vitamin A, B, or C deficiency or iron deficiency. When the tongue is swollen, there's edema or it's magenta, there's a B12 riboflavin or niacin deficiency. When the gums are soft and bleeding, there's a vitamin C deficiency. When the nails are pale, brittle, or spoon-shaped, there's an iron deficiency. When the legs have muscle pain or edema, there's a protein or thiamine deficiency. The Harris-Benedict equation is used to calculate non-protein calories in hospital patients. The equation is as follows. Men is 66 plus 13.7 times the weight in kilograms plus 5 times the height in centimeters minus 6.8 times the year in 8 times the age in years. For females, it's 655 plus 9.6 times the weight in kilograms plus 1.7 times the height in centimeters and minus 4.7 times the age in years. Calories can also be based on physical activity. If somebody is sedentary, they need 25 to 30 calories per kilogram. If there's moderate activity, it's 35 calories per kilogram, and heavy activity is 40 calories per kilogram. There's a decrease in a total of 100 calories for every 10 years over the age of 30. Albumin is a prolonged protein deficiency, and it can be influenced by dehydration, fluid overload, burns, cancer, TB, nephrotic syndrome, and pregnancy. It's not a good indicator of protein-calorie malnutrition because of its long half-life and also because albumin is replenished by other albumin. Prealbumin is a better indicator of short-term protein therapy. It's influenced by iron status, trauma, infection, and recent protein intake. It has a shorter half-life than albumin. Transferrin transfers iron, and it's a predictor of protein status and iron depletion. It's elevated with iron deficiency, and it decreases with protein-calorie malnutrition. CRP is C-reactive protein, and it's a reaction to stress in the body. That can be infection, inflammation somewhere, disease. When CRP decreases, that's an indication that more aggressive nutrition support can begin. Hematocrit is the volume of red blood cells. It's decreased when there's anemia, and it's increased with dehydration. Hemoglobin contains iron and it carries oxygen. It's determined by the amount of red blood cells. So now hematocrit was the volume of red blood cells. Hemoglobin is the amount of red blood cells. Hematocrit is volume of red blood cells. Hemoglobin is the amount of red blood cells. Mean cell volume, MCV, is red blood cell size, which is different than hematocrit and hemoglobin. Its elevated levels indicate macrocytosis from B12 or folate deficiency. Low levels indicate iron deficiency or blood loss. TIBC is total iron binding capacity. It's the total amount of iron carried in the plasma by transferrin. Iron levels are equal to 1/3 TIBC. So, if the TIBC is increased, then iron is decreased in iron deficiency. NLEA is the Nutrition Labeling Education Act of 1990. it mandated that nutrition labels and nutrition facts needed to be on most processed and packaged foods to indicate the nutrient value. Low fat is less than or equal to 3 grams per serving. Low sodium is less than or equal to 140 grams per serving. Low cholesterol is less than or equal to 20 milligrams per serving. If something is high in a nutrient, it is greater than or equal to 20% of the daily value. If it's a good source, it's 10 to 19% daily value. If it's a healthy product, it is low in fat, saturated fat, cholesterol, and sodium, and it is at least 10% the daily value of vitamin A, C, calcium, fiber, iron, and protein. Kwashiorkor is a disease of protein deficiency, although adequate calories. It is indicated when there's edema, skin sores, and someone cannot resist infections. Marasmus is when there is low protein and calories. So we have Kwashiorkor is just protein deficiency, enough calories. Marasmus is low protein and calories. It's indicative of weight loss, decrease in hormones, and decrease in body temperature. Failure to thrive is growth retardation from low calories, not ingesting enough orally, and it can be organic or non-organic causes. Organic is some type of disease that causes it. Non-organic is parental, not enough love. Rickets is not enough vitamin D, and that's in children. Osteomalacia is rickets for adults. Vitamin A deficiency is there's no bone growth, and a toxicity increases clotting time, there's fatigue, brittle nails, and rash. Vitamin D deficiency is rickets or osteomalacia for adults. Toxicity is withdrawal of calcium from bones, kidney stones, and excessive thirst or urination. Vitamin E deficiency is red blood cell breakage, and it occurs with cystic fibrosis in children. Toxicity is rash and fatigue. Vitamin K deficiency is hemorrhaging and increased blood clot time. That means somebody can bleed out easily. Toxicity is jaundice or an interference with blood thinning medications. Vitamin C deficiency is scurvy and decreased wound healing. Toxicity is rebound scurvy if somebody does not continue with supplementation, rashes, and diarrhea. Thiamine or B1 deficiency is beriberi, and it occurs mostly in alcoholics. Riboflavin or B2 deficiency is erybroflavinosis, chelosis, skin rash, or fissures at the corner of the mouth. Niacin deficiency is pellagra, diarrhea, dementia, and death. Those are the 3 Ds, diarrhea, dementia, and death of niacin deficiency. Vitamin B6 deficiency is sideroblastic anemia, and toxicity is depression or fatigue. Pantothenic acid deficiency is burning feet syndrome, and toxicity is water retention. Folate deficiency is a red or sore tongue, weight loss, and birth defects. Toxicity is B12 deficiency and insomnia. B12 deficiency is pernicious anemia because it can be caused by a low intrinsic factor, and toxicity is a decrease in renal function and kidney stones. Biotin is often, a deficiency in biotin is often reported with prolonged TPN.